Hello, ladies and gentlemen from across the world. It's my honor to welcome you all to our second webinar dedicated to raising awareness of breast cancer during the month of October. Today, we will discuss a topic that touches the lives of countless individuals, the role of compression therapy in managing post-mastectomy lymphedema. Breast cancer remains a global health concern, and during Breast Cancer Awareness Month, it is crucial to equip ourselves with knowledge and tools to support survivors and enhance their quality of life. Post-mastectomy lymphedema is a condition that affects many breast cancer survivors, and understanding effective treatment is essential for their well-being. We are truly fortunate to have a distinguished expert in the field as our speaker today, Mr. Evripidis, who has more than 15 years of experience dealing with lymphedema patients. Mr. Evripidis is a member and certified instructor of the German School of Lymphedema of ZML Prestigium. He is a member of Greek, German, and International Society of Lymphology. He is the first physiotherapist member of the scientific board of the Association for Women with Breast Cancer, Almazois. In the next 40 minutes, Mr. Evripidis will share his expertise, insights, and the latest advancement in compression therapy for post-mastectomy lymphedema. He will shed light on the importance of early detection, prevention, and effective management strategies. We hope to empower you with the knowledge and tools to support the fighters, admire the survivors, honor the taken, and never give up hope. After, Mr. Everpedy's presentation, we have a short presentation about different type of compression therapy product that can be used to support our patient and improve their quality of life according to the different stages of lymphedema. Before we begin, I urge you all to actively participate in this webinar. Your questions and engagement will make this session more enriching for everyone involved. Please write your question in the Q&A section. Thank you for joining us, and let's start our webinar. Mr. Everpredis, please, the virtual stage is yours.
Hello, everybody. I'm really happy to be here with you. I think it's a really international group from almost all continents around. And I hope that we can share some moments together. And I hope, let's see that if I can fulfill your wills and give you some new options about lymphedema with compression, which is a very important part. As a physiotherapist dedicated to lymphedema the last years, I say that I have quite a big experience with many patients, and yes, I try to incorporate all the knowledge and the ideas in the upcoming lecture. So let me share my screen. It's fine. I hope that everybody can see.
Yeah.
Yes, if you have any questions, just write in the question and answers. And yes, Mr. Karam at the end will just read it and we can answer as many as possible. And you can be free to ask anything you like and we can discuss all possibilities. So, yes, this is the month of, about the awareness for breast cancer. And yes, let's start talking about breast cancer itself. So we know that, yes, some sources I got from the World Health Organization, which is, I think, from the 2020-22. This is the most diagnosed form of cancer globally among all forms of cancer. And this accounts of 12% of all cancer cases worldwide, which makes it the leading cause of cancer deaths among women. Yes, it's a really important form, and we know that many women suffer of this. And fortunately, at least it's important that we can see globally and increase awareness. So many doctors in the medical field, many associations, they're really looking around women, taking care and founding options and treatments and support for all these women that suffer. Yeah, in 2020, also this is data I just got recently from the World Health Organization webpage. 2.3 million women were diagnosed with breast cancer in 2020. And from those, that caused 685,000 deaths in the same year. So, so roughly half of all breast cancers occur in women with no specific risk factors other than sex and age. So this is only about women. So yeah, breast cancer, of course, we can see in every country of the world. So it's a common field. This is something that really unite us all. And yeah, this is not a good thing that unite us all, but unfortunately is there. And approximately half to 1% of breast cancers occur in men. So few men, we can see that in the daily practice, not quite often, but some cases we can see men suffering also from breast cancer. The last 5 years, and this is interesting because we can combine the statistics later with lymphedema, the last 5 years, 7.8 million women alive were diagnosed with breast cancer. So only the last 5 years, and this doesn't count previous years, we have 7.8 million survivors. And this is a number we can keep, so later we might give some calculations. Now, yeah, fortunately also, we can say that breast cancer can be treated in most of the cases. Of course, unfortunately, at least this is from my perspective, from the clinical experience, many women delayed a lot during the last years with COVID. So because of COVID, they didn't reach early enough the possibility to have a medical treatment. And then that would also ended up in some bad results, either death or many complications because of the heavy treatment. So the management protocols of cancer include the following procedures, which are different. We can have operations. So this is usually the tumor removal, unless it's a metastatic process, so they probably might not do it. We have lymph node removal, and with the breast cancer, it's quite common for many, many years now, the sentinel lymph node dissection instead of the lymph node dissection itself, when they used to remove all possible lymph nodes from the axillary region. We have radiotherapy, and I underline these two because these are the two most important we have to see about lymphedema. We have chemotherapy, we have hormonal therapy, we have immune therapy. So there are combinations. Every case is different. Doctors always decide what is best for their patients, and we can see either one or the other. Sometimes we have only operations, sometimes we have only radiation, sometimes we have all a combination of everything. So it is important to understand that lymphedema can appear during every phase. So when women ask, when can I have lymphedema, or is there a possibility? Of course, from immediately after the surgery, we can have lymphedema. On the other hand, if we have it immediately after the surgery, we might not call it lymphedema yet. We have to wait. Yeah, the period depends, varies from 6 to 8 weeks. I say that 6 to 8 weeks is already too late, especially for a lymphedema in the arm. Yes, an edema on the breast 3-4 weeks after the operation could be possible under specific circumstances. But an edema of the arm 4 or 5 weeks after, it doesn't fit with the healing phases. So probably it's already a lymphedema that it continued from the post-traumatic, post-operative edema. So depending on when the lymphedema will start, that will change a little bit the handling. For example, it's different if we have a edema that will develop to the lymphedema immediately after the operation. It's different if we have a lymphedema appearing during the radiation or sometimes later during chemotherapy or other procedures, or even just during the time after the operation. So yeah, I know that all from the audience, most of you are experts, you're health professionals, you probably have an idea, but just fast to see the lymphatic system in accordance with the circulation system. So of course we have the heart, and from the heart we have aorta and the big arteries. they end up in the small capillaries, which is the part of the circulatory system that have fluid exchange. And from the capillaries, okay, of course, this is a very important procedure for the human body to survive. And this actually is the beginning, because this is a pipe that it is always open. So we will always produce fluid in our body. And then, of course, a big part of this will return to the heart through the veins. So we have a circulation that with circulation will provide constantly all tissues with important nutrition, so we can survive daily. And like everywhere, we can have waste. So either this small part of this fluid, or even now there are modern researches from physiology saying that there is no really reabsorption in the capillaries. Everything going out will stay to the interstitium, and then this is a part of fluid that must be transferred somewhere else. And this is the main reason, the main aim of the lymphatic system. So the lymph vessels will just suck all this fluid, and they will lead it to the lymph nodes. The lymph nodes, they act as filters, and they will, not really clear, that they will split the fluid, and they will say, this is a healthy part, it will return back to the veins. Or if there is something dangerous, they will initiate an immunological procedure. So one thing we have to understand, and I have to point out, of course, that everybody knows that veins and lymphatic vessels, they have valves, because they have to prevent the backflow. And I will discuss this later. And it's very important that we need some natural procedures like the muscle pump and the joint pump. So it's very important to point out that this whole circulation, or this movement of the fluid through either the veins or the lymphatic system, it can occur on its own, either from the sucking of the heart or from the pumping effect created by the smooth muscles of the lymphatics. But also this is not enough. So the human movement itself, because the human body is made like this just to help it, so we need movement. So the human body, in order to work and do the normal functions every day, it needs movement. The joint and the muscle pump, yes, together with the breathing, which also it's a kind of muscle pump, all this together, they can enhance the return of the fluids back to actually to the circulation system and the heart. So from this point, we are going to take information to discuss later why we need compression, which is the main topic of this webinar. So what happens? We talk about cancer. So we know that in the Western world, main cause of lymphedema is cancer. Why? So if we remove the lymph nodes, and if I go back, if I remove the lymph nodes, which is, sorry, let's go back. So if I remove the lymph nodes, and I actually block in a way, so I have the lymph nodes here. If I take them off, it's actually a blockage to the pathway. Eventually, the body will try to cope with it, to compensate, but this compensation is not always possible. So if I go and I see the red line, which is the transport capacity of the lymphatic system, which is the maximum capacity of fluid that it can transfer, every damage to the system will reduce this capacity. So the operation itself, with the removal of the lymph nodes, the radiation that will radiate lymph nodes, the leftover lymph nodes in the axillary region, for example, or will just radiate all the lymphatic vessels around. This will create inflammation in the walls of the lymph nodes and the vessels, and this inflammation will create fibrotic tissue, so the expansion will become smaller. And this will reduce the transport capacity. Chemotherapy will affect the human body, will affect the organs. We don't know how much of these toxic substances will affect the lymphatic system. It's not really clear, but of course, all the chemotherapy at the end from the interstitium will be transferred through the lymphatic system. So as we know, sometimes the chemotherapy can create damage to the veins. In a similar way, could create damage to the lymphatic vessels, but this is something I haven't found clear evidence. Nevertheless, all these procedures will reduce step by step if we see the transport capacity of the lymphatic system. So if we have a lymphatic load, which is the yellow line, and this is the lymphatic load during rest, so this lymphatic load can change during the day. So that's why some people go up to the stage 1 of lymphedema, which means when the yellow line crosses the red line. So we can have a stage 1, but here, when the red line really reduces that much, that goes below the normal lymphatic load, then we have edema inside the tissues. And this edema, because of the mechanical insufficiency of the lymphatic system, we will call it lymphedema. So, of course, yeah, I don't spend much time here because it's knowledge you know, but just to point out, lymphedema is a chronic disease. Actually, it's a pathology. It's a pathology of the lymphatic system. And we know that worldwide, the main cause is filariasis. Yes, this parasite that develops through the lymphatic system and it interferes with its function. But in the Western world, the main cause is the treatment of cancer. Sometimes, of course, cancer itself can create lymphedema when it will develop in the lymph nodes or nearby the lymph nodes and will compress them, so it will not allow them to work properly. In this case, we can have a malign lymphedema. Otherwise, the normal treatment of cancer, which is, and we have survival rate, quite big survival rate, the lymph node dissection and the radiotherapy will affect the function of the lymphatic system. So, what are the factors that increase lymphedema? Yes, there are many researchers. This is not a very, very young one from Chai and his partners in 2009. So he pointed out some steps during the cancer treatment phase, which is the surgical procedure. Either we have a breast amputation or only the tumor, or we have a lymph node dissection or sentinel lymph node. Of course, the procedure itself, so they recognize that the kind of the procedure, the doctor itself, how delicate he is with his approach, the number of the lymph nodes. If the lymph nodes were infiltrated by cancer cells, if we did radiotherapy, what kind of radiotherapy, how many radiation, how strong they were, how about the device itself. You know, some of you are from countries that the finances of the health system is not that good, and we experience, even in Greece, that some devices are not that well maintained, and that can influence also. And of course, something that it is not pointed out here, but I have to mention as a physiotherapist, we have to understand that every woman is going to a breast cancer treatment with a human body, that it has some genes and it will develop such a way. So we're not the same. Some people, they have stronger bodies, better developed bodies, some others they don't have. And of course, what is really important, and this is something that we deal with it every day in physiotherapy, is that the influence of function to the human body. So we know that the human body will reflect the function. So we have bone expansions because there are too many tendons pulling. We have muscles growing because of the activity. We have, for example, or on the other hand, we have intestines not working properly, where we have constipation because we don't move. So, of course, if I'm reaching cancer treatment in a bad shape because I'm not eating well, I'm not moving, I'm stressed all day, which are all of course causes of cancer too, that will affect probably the result after the cancer treatment. So now, what is the incidence rate of lymphedema? Yeah, here it's interesting because, for example, yes, there is a meta-analysis of 72 papers from the CPO and his associates in 2013. So he found an overall incidence of 16.6%. Let's see, but this is an overall. So we don't know, I don't remember, I pointed out the span of the numbers. Another from Hayes and his associate in 2007, lymphedema after breast cancer, he found it that after 6 to 18 months after surgery, there's a 33% having lymphedema. So even a bigger number. And it's interesting because the lymphedema in a 10 years follow-up, and this is something I have to point out, the follow-up, because in every research it's important that lymphedema, for how many years they observe the patients. So in this research from 2017, we have a cumulative incidence of lymphedema that is 13.5% at the 2 years follow-up, 30% at 5 years, and 41% at 10 years. So now, if you are experts and you work with lymphedema for many years, you have probably met patients that they developed lymphedema not only after 10 years, like it is mentioned in the last research, but also after 20 or 25 or 30 years. And now, if we consider that the survival rate of breast cancer is really higher the last years, then the percentages can become bigger and bigger. So actually, one thing that will prevent lymphedema from occurring is death itself. If we have a woman of 80, 85 years old that will not survive, not because of cancer, but because of AIDS, for not more than 1 to 2 years, then maybe she will not develop lymphedema, not because that she wouldn't develop. She will not develop because she will not survive that long. If we see young people, the possibility of to develop lymphedema, unfortunately, and this is something, patients doesn't like to hear, but this is the reality. If you're young, the possibilities to develop lymphedema are quite high. So, if you ask me, what is the golden number? I don't really know. So, even in other research, there are many, many different percentages. And if we have to give a gold number, can we say over 20%? I don't really say, I cannot really tell that we can say that. We can say this is 20%, because we have to consider the previous slide that says there are risk factors. So, of course, the incidence rate of lymphedema after a woman treated from breast cancer, but only sentinel lymph node dissection without radiotherapy, the percentage might be minimal. It's about 3 to 6%. But of course, still we have to consider time. So we saw before the red line in the graph about the mechanical insufficiency. And this red line will continue to drop every year of our life just because of age. So the more we'll survive, the more the red line will reduce. And really, we cannot really tell. So yes, I can use the researchers. I can use these researchers to talk to health professionals or to talk to some doctors in conferences. But really, in our clinical environment, we cannot really tell. This is why lymphedema management is so important, because if you get lymphedema, and this is a chronic disease, you cannot go back in time. But on the other hand, just keep this to 20%. And now, if you remember, we talked in the beginning about 7.8 million, if I remember right, survivors of breast cancer the last 5 years. So if we see this number, 7.8 million with 20%, this is 1.56 million potential lymphedema cases. And we don't know how much this number expands and about the survival rate. And this is only about the last 5 years. If we control a longer period of time, because again, unfortunately, I would say that there are women that they have breast cancer in a relatively young age. Only recently, I have quite a lot of women, especially during the years of COVID, that they develop breast cancer at the ages of 30, 32, 35, 40. You imagine that if they survive, which it is highly possible, then the possibility to develop lymphedema among their lives is quite big. Oh, this is a big question of everybody. Can we really prevent lymphedema? Here I have to point out two big aspects. One is the post-operative manual lymph drainage for prevention. And just searching, because this is something we hear a lot. In Germany, I think this is one gold standard now. In every hospital, every woman after breast cancer, they are having, I think, 6 sessions every day with manual lymph drainage to reduce the possibility of lymphedema. So Dr. Lacombe and her associates in 2010, they found that, yes, if you apply early physiotherapy, of course, this includes manual lymph drainage, but also scar tissue management, mobilization, restorative function fast, which is also important. So we understand that the good function of the lymphatic system is related to good function. So the lymphatic system cannot work very well, like we talked before, without the movement. So the fastest we restore the movement, that will make the lymphatic system work better. But this research, like the other also I'm pointing lower, that you have an early prevention of lymphedema with physiotherapeutic stimulation. They did manual lymph drainage to patients after breast cancer with a control group, and they found out that the percentages of the control group developing lymphedema were higher, significantly higher. Although here, it will come, we have a debate, because we know from researches that the effect of manual lymph drainage on lymphedema, it is questioned. So we know that there are countries, like I know in the Scandinavia, they are not using anymore that much of lymph drainage because they say, according to researchers, it's not that effective. Of course, there are many questions that can be issued, because when we control lymphedema of the arm, do we control the lymphedema of the breast? And what happens to the lymphedema of the breast if we don't apply the manual lymph drainage? This is a big question. But here, the prevention has to do with physiology. We know that during the inflammation phase, after an injury, and an operation is an injury, we have growth factors released that will provoke the neoangiogenesis of the lymphatic vessels. So we have new production of lymphatic vessels. The more edema we have after an operation, that, because fluids will compress everything around, will reduce the blood flow. And that probably can explain why, if we apply the lymph drainage post-operatively, immediately after, during the inflammation phase, so that for me, from my understanding of physiology, that has to be in the first 7 days post-operatively. If we apply the lymph drainage, what we really do is that, reducing the interstitial fluid, we reduce the pressure. Reducing the pressure, we release the blood capillaries. We have better blood supply. Probably we have better transportation of growth factors for the lymphatic system. And maybe this, from one side, can enhance the neoangiogenesis of the lymphatic system, but also, on the other hand, can guide the lymphatic vessels to follow the proper direction. Because we know that when we have production of new tissues, like collagen, the forces applied directly after, it's really important to guide the vessels or the collagen fibers to the proper direction. So, from my opinion, yes, this is the only thing someone can try to do. Of course, we need further researches to prove this thing. So we need to prove that this really appears. And yeah, if you ask me, okay, of course, I'm satisfied from the researches I've seen, from the clinical experience, but really we need to investigate in a physiological level. The other aspect to prevent lymphedema is, educating the patient, informing the patient, restoring normal activity, compression garment. So it's, and now we first come across compression. So it's important that we have to educate our patients. If we have a high risk to develop lymphedema, lymph node dissection, radiation, bad physical condition, overweight, then the possibilities of lymphedema can even go over 50%. So then it's really necessary and critical to inform the patient, explain the possibilities, and try to normalize as possible the activities. So yes, but now here is the question, do we really prevent lymphedema? No. If you ask me personally, I don't really think that we can prevent lymphedema. If we say that we will survive long, so it would take out time. So we say, okay, I'm not 85 years old, I'm 40 years old. Then the longer I live, the possibilities are getting bigger and bigger. So here, just taking care of my life will not prevent, but we can say delay lymphedema, which is important. And since there's also a debate about compression garments, I searched about this, and I find the research that they use prophylactic compression sleeves to reduce the incidence of arm lymphedema. And yes, in this research also they found that to the group that they applied compression garment immediately after and for some period, then there was a reduced rate of lymphedema appearing. As I said, yeah, we don't really prevent, but we can control that. And of course, here we will discuss later in the topic of compression garments about the decision which kind of compression garment. Because on the other hand, my clinical experience, I've met cases that they developed lymphedema, or the lymphedema shifted, or it was developed in more areas than the initial one when they applied the wrong garment. So this is a big controversy among scientists. Do we really have to wear a compression garment after the operation for prevention, or does it really play a role? What kind of compression garment? So this is something we will answer later. Yeah, so I would use prevention from the left for the left box, post-operative minor lymph drainage. I will use the word delay for the right box, where it's about education, information, and restoring of normal activity. So let's go to the question, lymphedema, treatment or management? Yeah, because we usually, when we talk among the health professionals, we talk about treatment of lymphedema. But actually, as a physiotherapist, if I want to be honest, I would say lymphedema treatment lies in the medical field. So yes, of course, all of you, if you attend world conferences, medical conferences about the lymphatic system and lymphedema, that there are surgical procedures, lymphovenous anastomosis, autologous lymph node transplantations, liposuctions, and all doctors, they're claiming they're treating lymphedema. Okay, here it's a big question. Yes, do we really treat lymphedema? Yeah, I don't know. I cannot really say that we can have 100% healing, like restorage of the previous condition. So I had 30, 40, 50 axillary lymph nodes. I had 30 dissected, and then I did some lymphovenous anastomosis, or I transplanted some lymph nodes there. So do I really come back to the initial transport capacity? No, for me, this is a big question. I have seen very good results from doctors, I have to be honest, and patients, they were happy. We have edema reduction, but these results lasted lifelong. Oh, this is something, this is a big debate. On the other hand, we have the conservative, and here, I use the word conservative treatment, which is chronic, but then the conservative treatment becomes a management, because you really manage in the long term. You don't treat for a few sessions and you are done. And yes, the gold standard is the complete decongestive therapy. And I was really surprised when I realized, traveling around the globe, that it's an international consensus that complete decongestive therapy is the gold standard of the treatment of lymphedema. And it's interesting because, with many other pathologies, for example, if we see a low back pain, we can find hundreds of thousands of researches claiming that the one or the other approach, so it's manual therapy, it's acupuncture, it's trigger point technique, or it's fascia, or it's exercise, or combinations that they can treat low back pain. But here, it's a complete decongestive therapy. And of course, in the decongestive phase, which is the first phase of treatment, we have a combination of application of manual lymph drainage, bandaging, skin care, movement, and elevation. And although we have this agreement that we apply this kind of complete decongestive therapy, every therapist is allowed, and they already do, every school, they present their own lymph drainage approaches, their own bandaging techniques, their own way of skincare, their own special exercises. But, at the end, they're all aiming at the same thing. They're all similar things. Or I use the A cream or the B cream, or my techniques were like this or that, like that. But it doesn't really matter. The philosophy, the principles behind the complete decongestive therapy are the same. So at least all the trained therapists, the certified therapists, that they followed the principles, they do the same. So in this first phase of the complete decongestive therapy, which the main aim is to reduce the edema, we do consecutive treatments. So we do every day. And we need the bandaging to stay between the sessions. And this phase ends with the delivery of compression garments. So already here we can see two big aspects of compression bandaging and compression garments. Because then the preservation phase will follow. And the problem with the preservation phase is that it's lifelong. And I will keep lifelong because if you ask me personally, the decongestive phase was not really a challenge. I could persuade my patients, they could follow the treatments. I couldn't find the material, even if the material was funded by someone, it doesn't matter. But we could reduce the edema. So it's funny because this is what I say also to my courses, that complete decongestive therapy is really effective. It's unbelievable. It will have a positive result regardless of, unless we do some serious mistakes. So if there is no result on the complete decongestive therapy of the decongestive phase, then there is something serious. For example, we have a malign lymphedema. We have an artificial lymphedema. We have some other, for example, hygiene issues like continuous infections. But if there are no problems, complete decongestive therapy will be effective. So the decongestive phase is not a problem. The phase that I really had a problem in my life was the preservation phase, which is lifelong. And how you can persuade the patient to do a lifelong treatment. So here it's very important, the self-management, the compression garments, the movement. And here, although many people, they're claiming they're doing the proper exercises for lymphedema, I always say movement. You have a normal life. And occasionally, we need treatments with manual lymph drainage and bandaging. So as I said, this is a world standard. So regardless of how I do the combinations, everywhere they're doing something similar. So compression therapy, this is the most important aspect of managing edema. And I can say this, I didn't find any research against the application of compression. So I didn't find any research that's saying that compression is not effective. And this is very interesting. So there are questions for everything about garments, about bandages, about manual lymph drainage, but about compression, with any form of compression, no, it's not. And let's go now to understand why compression. Let's go back to physics, to physiology, to anatomy. One important aspect is gravity. Unfortunately, of course, not, but this is not unfortunately, this is a fact. We are standing creatures. We have two legs. And standing, we have the gravity pulling us down. So of course, in ourselves, we're full of channels, and every fluid will be pulled downwards from gravity. And now, here this is important to understand the function and the importance of the valves. If we didn't have these valves in the lymphatic vessels and the veins, then this fluid pulling downwards will be, it couldn't be prevented. And also we know that liquids, this is as natural elements, they cannot be compressed. We cannot really compress liquids. So liquids will always try to find their way out. Probably all of you know how you can open a safe. You can pour water inside, you can freeze it, and then it explodes because you cannot really compress water. it will try to find the way out. We see mountains opening because fluid wants to go out. And this is lymphoria, when we have really extremely expansion of the extremity, and then the fluid finds its way out through the pores of the skin, so through these small holes. And it's important to understand that fascia and skin are the first physiological barriers to fluids. So why an ankle sprain edema will hurt? Because it will create fluid, edema, and this edema will expand. And what will stop this edema from expanding? This is the skin of the foot. And because it is stressed that much and it compresses these mechano and nociceptors, that will create pain. So we have gravity, we have fluids that cannot be compressed. We have the natural compression from the fascia and skin or the other organs. But then we have also the Laplace law, who said that the pressure applied is relative to tension and reversely relative to the radius. So this is also what happens inside the vessels. Then why do we really need compression? Because we have mechanical insufficiency of the lymphatic system. So it cannot suck the fluid, and the fluid will start congesting on the extremities. And the gravity will keep the fluid there. So we cannot change that. The fluid will go down. And, the lymphatic system is doing the natural physiological decongestion. So, and this is insufficient. So edema will increase in time. It's like you have your bathroom, you open the tap, and then there is a leakage. And there's a leakage every day. So there is water on the floor. And the water will become more and more and more. What is the speed of this fluid increase? We don't really know. That depends. That depends on the fluid running in and the fluid running out. So we need a constant counter pressure from the outside. So since the fluid is expanding from the inside, and we cannot stop it because this fluid expansion, especially with lymphedema, will be slow, then we need to apply a pressure from the outside to stop this. So this is actually why we need compression. So to apply compression, we have many different options. And this is something that industry provides us, and I can say we have to be happy for this thing. So physiotherapy with edema management, it depends a lot on the material we have. We cannot really treat edema without something. I can make my own bandages. If you go to countries with a low financial status and there are people, that they're having nothing, you can even take clothes and you can torn it to stripes and you can make your own bandages, but you still need to find your own way. So we have the compression bandages, and I mean all the different materials included to that. We have the compression garments, and we always use the word garments because there are different kinds of clothing, cover every body shape. We have special compression applications, and of course we have the intermittent compression. And since I'm not talking later about the intermittent compression, these are devices applying pressure from distal to central to proximal to the extremity. There are two questions about this. If we press from distal to proximal, is the proximal part ready to absorb the edema, or we can just shift the edema from the arm to the breast? This is a big question. Of course, the same will happen with bandaging, but the bandaging will follow the treatment, so we can prepare the area. And of course, we can also decide the speed of the bandaging. So I never bandage up to the axilla from the first day. I always do an elbow up to the elbow bandage. See how the area will react, see how the edema will be absorbed, and only if I can see that this absorption can happen, only then I will go up to the axilla. So yes, this is the artificial counter pressure we apply with all this material. So we have the bandages, we have the garment. You see bandages, many different forms, and I will explain. We have the garments, and we have different options for the patients to use during day or night. And before I go further, just, as everybody's a therapist, from my perspective, what is the biggest problem or the most important aspect for a successful treatment? This is a plan. So when I see failures of complete decongestive therapy, it's not because the treatment strategy is not effective, but because there's a lack of plan. For example, I always remember I met a patient a couple of years ago, and she was telling me that she was having uh, treatments with a colleague, and she did 15 consecutive treatments with manual lymph drainage and bandaging, and she had a very, very good result. But at the end of the sessions, the physiotherapist, because it was end July, she had to go for vacations, and she left the patient without garment. You know, in my years, this is unbelievable. So she left the patient, and of course, the edema reappeared soon, really after the treatment. So yes, she had a good result, but she couldn't keep it because she was lacking of plan. She didn't plan the vacations. So I never start treatments when I know that I'm not able to deliver the garment in time before I leave or the patient leaves. So the plan always has to start the first day and must follow the patient till the end of his life. So this is why I always say in lymphedema, we're more than therapists, we're health consultants. So we always play a role of consultant with the patients for his everyday life. And to have a successful treatment here, we need all therapeutic options and solutions. So before I start, I need to plan about my bandages, about my garments. I need to know about my self-management possibilities. I need to know everything. And every form of compression serves a special purpose. So all this I explained before. They play all this, all these uh, all these different aspects. They are there because of a reason. And if we want to see this reason, so let's start in the different fields. So we say, we talked about prevention. So what is the role of compression for prevention? As I said before, I was about to explain a little bit more. So prevention, we can mainly talk about compression garments because here we don't have lymphedema. So we don't have a problem. And if we apply compression, we need this compression to be functional, not to disrupt the quality of life of the patient. And yeah, round or flat knit? Question one. Custom or ready made? This is the second question. The answer depends on the existence of the edema, on the shape of the extremity, on the size of the extremity, and of course the functional demands. I would say that lymphedema, from definition, is an asymmetrical edema, but not asymmetrical, but an edema with not regular shape. It's not like a normal extremity. If you check your arms and you have no lymphedema, you have a normal shape. So here we don't have lymphedema. So we can have a normal shape. But do we always have a normal shape? For example, if I'm obese and I have a really lobulous extremity, how then I can fit a ready-made garment? And I cannot really do. Because if you order a ready-made round knit garment, if you see the table of the sizes, then sometimes you don't fit. Of course, the companies, sometimes orthopedic shops, they sell it because they have to sell it, but this is not the proper solution. So from my experience, if we use ready-made round knit products, and I'm not talking about brands, I'm not talking about qualities now. If we have these rubber bands at the end here on the hand or higher up at the axilla, we can even create an artificial lymphedema. So I had many incidents in my clinical experience of patients that, in the past years, I used to allow them to continue wearing the round knit ready-made garment when they had it and we were supposed to start our treatments a few months later. So I was telling them, yes, you can do it. But then the occurrence of lymphedema was really high. So many patients, they had problems after that when they were coming back. So they were worse. And then I realized that for me, a ready-made garment, it really, if it fits, I'm okay with it. But it's not statistically possible that it will fit. So I'd rather to have a flat knit, custom made, fitting to the extremity and doing its job properly. So this is the question about prevention. So if we talk about prevention, the only thing we can discuss is using the compression garment when we know from research is that the highest rate of lymphedema is the first. We know from women after breast cancer, the first 2 years are the most possible to develop a lymphedema. So yes, this is what I recommend sometimes to my patients if they're young, if they're active, have small children. So small children, what they mean that I can have forces that I cannot predict. So the children might fall and I have to jump and do something fast. So then I might recommend. So if I have a high risk factor, lymph node dissection, radiation, young patient, active, with not predicted life, like small children, then I say, yes, for you, it's a possibility. No, I wouldn't recommend a garment to a patient with only sentinel lymph node dissection, with a 3 to 6% possibility. I think it's too much. Now, if we go compression for treatment, yes, during the first phase of CTT, circumference changes constantly. So we need adaptable solutions. The extremity will change every single day. So we need material that is reusable or actually washable, so we can use it again and again. And we need a relatively low cost per treatment. So I know some patients, they ask, or some therapists, they do this, they say, can I use compression garments? I say, yes, you could, but then you need a compression garment every day, a custom-made compression garment every day. First of all, I cannot have it. And second, it's really, really expensive. So this is the main reason we need the bandages. And then we have the multi-layer bandaging, because with the different aspects, we have skin protection, we have finger bandaging, we have paddings, even or uneven paddings, depending on the density, on the fibrotic tissue. We have short stretch bandages, we have tape for stabilization. So since we're talking about compression, some nice tips, some nice ideas that you can also incorporate to your daily practice. Of course, you know the stockinets, the tubular bandage we put above the skin for the skin protection. There are normal cotton ones, 100% cotton, just to protect the edema. I will show you an interesting one, which is the one tubular bandage called TG Soft. No, this is interesting because, first of all, its material is look like a towel. It's like a spongy towel. You know the towels, they have these small fibers. And I would say this is quite friendly with sensitive skins. So when you see patients that they are not reacting well, so they have developed redness, you see they're irritated, and we know that irritation will create active hyperemia, increased blood flow, and this increased blood flow, it increases the lymphatic load. So how we can treat an edema when we increase ourselves the lymphatic load? Then we need to pick up material that are quite friendly. So apart from the skin protection and the hydration cream we always use, I like this one to take it below. Of course, it's a little bit thick, or much thicker than the normal tubular bandage. But these fibers, like a towel on the skin, it will create a better reaction, and sometimes you will be surprised how good will be the result. And also, yes, and I have it here. You see, this is the material. So this is one side, and this is the other side. You see, I don't know if it can be seen. It's like small threads and fibers. And also, you see, this is elastic, and this small elasticity can create some slight compression, and it will help a little bit more. Of course, someone can say that this is long stretch. Yeah, not that long stretch, and since it's below, it doesn't really change much the compression. But this is a tip, and I will just say this: it's very nice for sensitive or bad reacting skins. And of course, this is also amazing just to make a tip for venous insufficiency problems and really sensitive legs. Approach. We have these gauze bandages for the fingers, different companies. But we face many times the difficulties that this causes that they don't stay because the patients, they move and they are worn out. So, or sometimes they are not resisting enough because imagine you have a man. We said that there are men with breast cancer, not common, but it can happen, with a huge hand. I have a big hand. And if you move a lot, these other small gauges, they can be worn out. Even if they stay, they will not apply the compression we need. So then we have this one. This is ideal binder. This is a nice white cotton bandage that we can apply directly on the skin. One good thing with this is this is washable, reusable. So per unit, it's 3 or 4 times more expensive, even more, 5 or 6 times more expensive than the normal gauze bandage, but I can use it many, many times. So in the long term, this can be cheaper. Of course, then you ask why we shouldn't use this instead of the other. Yes, but this is more aggressive. So if you have on the contrary, a small female hand without edema, this is too much, especially in the beginning. So this is for me a good option because with one bandage you can use it for the whole hand. Uh, it's a nice opportunity. And then you can use, this is the haft. Haft is a cohesive bandage. So it doesn't stick to the skin, but it sticks on itself. I don't really use haft directly on the skin, but what you can do is you can apply the gauze bandage, like Molelast, and then on top of Molelast, you can apply the haft. So you have a two-layer bandage, which is soft inside, but also stiff, and it doesn't expand. So it will stay. It will not go away because this cohesive ability of the haft bandage, and then it will apply further pressure. And also you can combine Molelast haft with the ideal binder. These are very interesting options about the hand bandaging. So about the padding now, yeah, when I talk about padding, for me, one of the best materials is this one, the Comprex. Comprex 2 is a very interesting striped bandage. If we talk about fibrotic tissue, you cannot really treat effectively a lymphedema if you don't use uneven paddings. If we only use the soft, even paddings, yeah, there is a limit. The fibrotic tissue will never change enough. So I like to use my scissors, and I always cut different shapes of this Comprex material. And definitely there are Comprex 8, so compression 8s. We have these ready-made kidney shape or different shapes of compression. But what I like a lot is to make my own solution. So you can buy this thick foam, which is different, and you can make your own paddings. So I like a lot this Comprex padding, which is a thick. We have different thicknesses, 1/2 or 1 centimeter thick, and lengths and widthness. So width, and you can cut and you can prepare what you like, and you can combine with different material to make your own paddings. And this is sometimes, if you see the industry, you realize that this is what they did. They combine things, so you can make your own, and sometimes you can make it cheaper. And yes, really, you have to be creative. Creativeness is a very important characteristic of a therapist. You have a patient, every patient is different, so you have to make for him a custom solution. So now if we go to compression for preservation, yeah, the garments are the kings of preservation. We cannot really talk about preservation of edema without compression garments, because compression garments, they fit to this lifelong phase of preservation of complete decongestive therapy. And you need something that it is easy to put on, look like normal clothing, and it can apply an effective and elegant compression. So yes, compression garments for me are really, really one of the most important parts of managing lymphedema. Yes, if you don't have access to compression garments, then you need to invent your own solutions, and then you have to understand that you must use things that are not so easy to use, but at least you have something to apply compression. And yes, we have the flat and the round knit. And this is a big question of everybody because from my experience, really few people know about the garments, why and what kind of garment. So we have the flat knit garments. They are knitted flat in machines and then they are sewn together to make a specific shape. And then we have the round knit, so they knit it as a cylinder. So let's say it briefly, the flat knit, they apply stronger compression, they have more density, they can resist more the edema, and they can last longer. The round knit, because of the material and the thickness, they cannot stand so good. So if I say lymphedema, I would definitely say flat knit, custom made. This is the gold standard because I have an irregular shape of extremity. I need to apply specific pressure, and then I need this pressure to be correct. Round knit. So if I go here, flat knit, custom made is stable, bigger lifespan, can fit in any dimension. Round knit is thin, good looking, normal sizes. So if I talk about lymphedema, I talk about flat knit, custom made. The round knit is mainly for prevention. I don't really like it for the arms, but yes, someone could do that. And for me, it's mainly for the prevention of venous insufficiency for the legs, but only if you have a regular shaped extremity. For example, if I'm a fat person, or for example, if I have lipedema, which by definition is irregular shape, then I need something stronger and custom made. So this is the gold standard for the garments, and you need garments, the proper quality of garments to treat your patients. And Mr. Karam at the end will give you some nice insights about garment options. Now, the wrap systems, I mentioned them separately because, they lie in between. They lie in between preservation and self-management. So some patients cannot put on the garments. They're old. Or even if they have home support and someone else can put the garments on, sometimes it's dangerous. Imagine an old lady with sensitive skin and someone that is putting the garment aggressively. Then you can make a skin damage. So it's better if you have a wrap system. So you can apply a very nice, very easy compression, easy to use. But also don't forget that compression wraps can be used in the maintenance phase to apply extra compression on top of the garments. So you have the garment and you have, for example, a big thigh and the garment is not enough. Or sometimes you even have a very big thigh or a very big arm and you cannot fit very well a compression garment. So then you might like to put a compression wrap. Or because of the sliding, as I said before, you have sensitive skin or wounds, then you better use a wrap. So wraps are quite clever. They're not, they don't worth it for every patient. But yes, if you have this option, it's amazing how many possibilities you can add or how many problems you can solve. And then I have to go to the compression wraps, for self-management. So a good therapist always must give control to the treatment of the patient. And we need material that resemble the treatment. Easy to use and applicable sometimes during sleep. And as some patients say to me, during sleep is a free option because you don't really feel it, you sleep and it's done. Here, we have some very nice options and you have material like this, you can put for the arm, for the hand, and then you can sleep with it. Is it nice? Or you can have similar options for the upper extremity. But what I like a lot also is this kind of swell spots. And you can use them in some specific areas. And sometimes people might think that they might be a little bit more expensive. But the truth is that in everyday life, you need easy things. You cannot do complicated things every day. So imagine you have a breast edema. So you can put your bra, women can put the bra, but they can put inside the bra a very nice swell spot. So they apply compression in a nice way without creating problems. Yeah, here you can see also sometimes you have this axillary web syndrome. But also, I have to say this, be careful with compressing the breast. This is not, you must be very careful how many hours you compress the breast, how long, if you do it during night. I always advise my patients to avoid too much compressions. So, for example, during sleep, I like them to be free without any bra or any compression. I like them to use compression bras plus swell spots during the day for specific hours for treatment. If we see lymphedema, and you see many, many different shapes, completely different cases of arms, hands, fingers. So we need to have options. We need, for all these cases, to apply different bandages, different solutions, and different possibilities. And if we do it correctly, this is a relatively old patient, but I really like this because you can see in few sessions, this is about 7, 8 sessions, you can see, if you see this, the circumference from almost 35 centimeter, it went below 29. So you can see reductions or from about 40 to 32, 6 to 8 centimeter reduction. And you can achieve, as I said before, we have the material, we have the options to apply proper compression. And yeah, I won't bother you more because I think I talked a little bit more, and yeah, Mr. Karam will shout to me because he needs also to talk a little bit. So lymphedema is chronic, and like every chronic disease requires management. So compression is the most crucial part of the treatment. We need compression. And then we have solutions, and industry offers a solution to apply the proper compression depending on the phase, depending on the condition, depending on the edema, depending on the finances. And so we can achieve even better results. But always stay critical, stay inventive, and make your own ideas what you think is best for your patient. So stay calm, enjoy the treatments, and I really thank you very much for your attention. I hope I was not really tiring you too much. Also, Mr. Karam, I think.
Thank you so much, Mr. Evripidis. It was great presentation, and thanks for your time for this one. I will just try to be quick on my presentation as well. I just ask if you have the participant, if you have any question, you can just write it on the Q&A section. And after my short presentation, we will have the discussion on your questions. So my presentation is going to be a short one in order to show you what are the different type of products that you can use with for compression therapy with lymphedema. Most of the products already covered by Mr. Sorry, it's full screen. So the presentation is not full screen.
Yes, we can see that.
Yeah. Okay. So my name is Luay Karam. I'm the global brand manager for Lohmann and Rauscher. And Lohmann and Rauscher is a company which is very well known with compression therapy products. We provide a comprehensive range of products and also a comprehensive range for compression therapy as a solution provider for lymphedema patients. So as you covered with Mr. Evripidis, we have the complex decongestion therapy where we have acute phase or the decongestion phase and the maintenance phase. And compression therapy is one of the elements and the most important element we can say because it stays with the patient for the most longer period of time during the treatment. And in the acute phase, we use the bandage, and the maintenance phase, we use the garments as shown previously. So in the acute phase or in the decondition phase, we can use different products. We can start from the fingers. The product that we can use for bandaging the finger is named Molilast. It's available in different sizes, and mainly in the finger, we can use 6 centimeter or 8 or 4 centimeter, depends on the size of the finger of the patient and the swelling itself. It's elastic, 80%, so it's not that high elastic. There is no not high, very high elasticity. Also, we can cover the molylast in order to increase the stiffness. We can have also another layer of molylast half or molylast half latex free, and also they are available in colors like blue or red color. We have another more stiff product that we can use also to bandage the fingers. It's called Ideal Binda. It's a short stretch, but somehow more stiff than the molylast if you have hard edema on the fingers or more big edema as well on the fingers. So we can use a stiffer bandage, which is Ideal Binda. Uh, this is the first layer or the first thing that we usually use. And then we have the tubular bandage. The tubular bandage, we have the TG tubular bandage, which is made from cotton 67% and viscous 33%. So there is no elasticity at all here in this product. It's a skin contact layer, so it's very soft on the skin, doesn't cause any allergy, and there is no wrinkles during the application because it's seamless knitting. We have also another one that Mr. Evripidis spoke about it, the TG Soft, the one with padding that we can use also with patient with high lymphoria. As a padding, we have different product for padding, starting from the very basic one, which is the Silona synthetic undercuss padding. Usually we use it also to protect the bony prominence or to fill the gaps or to fill the skin folds, to reshape and make the shape of the limb in a cylindrical shape in order to distribute the pressure equally over the compression therapy application or the multi-layer bandaging application. So this one is Celona synthetic undercuss padding. Usually it's not reusable or washable, so it is a disposable product. We have the Roosevelt Soft. The Roosevelt Soft is foam rubber bandage, which is washable and reusable. So this one is also elastic. We can say stretchable somehow, a little bit stretchable, and also highly permeable to air and humidity. We have the Rosdell SC, and the Rosdell SC is the new padding that combines two layers in the same product. So from one side, you have the tubular bandage or the skin-friendly layer, and from the outer side, you have the foam rubber padding. So if you're using the Rosdell SC, you don't need to use the tubular bandage because it is already stick to the outer side of the padding. We have the complex foam rubber pad. We have different shape from the complex, which is either bandage or either sheet or either pre-cut pads in a kidney shape or trapezoid or rectangular shape, sorry, oval shape, and also with different thickness for the bandage or the sheets. We have 0.5 and 1 centimeter different thicknesses. So we can use it also with the patient in order to help in breaking down fibrotic tissue, for example, or and also in order to reshape the skin folds patient or asymmetrical edema with secondary lymphedema patient. The complex 2 is very good product that we can use with fibrotic tissue in order to increase the skin integrity and break down the fibrotic tissue, especially with hard edema, because of its wavy shape made from rubber foam that can give a micro massage effect during the application. So we put here the tubular bandage, we put the bandage for the finger, then the tubular bandage, the skin friendly layer, then we have the padding with different type. So you have different tools that you can use, depend on your patient. Then the last layer, which is the stiff layer or the short stretch bandage, Rosidel K, which is very important because this is a bandage or this is the layer that compress the leg and increase the drainage and the fluid flow. So the short stretch bandage, Rosital K, is almost right now 62 years old bandage, very well known in the market and also very effective product. It's made from 100% cotton, where you can reuse it and wash it up to 50 times, which with availability in 4, 6, 8, 10, and 12 centimeter. So you can use it for different part of the body. We combine all the products in one package and name it Residual Lymph. So there is short stretch compression system for lymphology. They are available in different sizes, so and different for different patients. So there are small and medium, sorry, small and large for arms edema and small and large for leg edemas. And inside you have a full range of product that fits for the treatment of the patient. With molly for the fingers or for the toes for upper and lower limb. You have the short stretch bandage, you have the padding, and you have also the compress in the package of residual lymph. This is mainly the product that you can use in the acute phase. In the maintenance phase, as we spoke, or Mr. Evripidis spoke and cover, we have the arm sleeves from brand Venosan. The Venosan is brand for compression stocking and arm sleeves. We have the Venosan flat knit arm sleeves in different styles, from the arms, from the wrist till the arm, and with silicone band, and also from the wrist, sorry, from the knuckles till the armpit or the top of the arm, with and without the silicone, and also the gauntlet piece. They are available in two brands, Venusan Soft and Venusan Pro, with different stiffness from low to medium stiffness, and available in class 1, class 2, and class 3, with two different color, beige and black. This is a made to measure flat knit arm sleeve. For the circular knit, which is somehow um uh, very to be used with lymphedema patient, and we can position it in a different way. We have also Venosan 7000. This is circular knit, but the stiffness index of this product is high stiffness, or high stiffness index product. It's made from 8% cotton, 4% sea cell, with 62% of polyamide and 26% of elastan. They are available in different styles, from the rest CG till the arm, with and without silicone, with from the knuckles till the arm, top of the arm, with and without silicone, and also with the shoulder waist, available in class 1, class 2, and class 3 as well. They are made to measure in class 3. For the compression wraps that Mr. Evripidis also cover, we have the Ready Wrap. The Ready Wrap is a color-coded Velcro fastener with a stiffness index between 16 to 23, which is almost similar to the inelastic bandage. So it is good that the patient can use also to decrease a little bit of swelling in case they are non-compliant for the bandage. It can be used and can be reused up to 6 months. They are available in for the upper limb and lower limb as well. For the upper limb, they are available in two pieces with a ready wrap arm from the wrist till the top of the arm, with extra, we can say, extra padding available on the elbow to protect, with built-in sleeve for decreasing irritability to the skin, and straps with a color code, easy to use. Patient can wear it and do the donning and doffing by themselves very easily. They are available in different sizes and different lengths, so three different lengths because of three of the difference of the length of the arm, and three and four different circumference and sizes for the arm piece, and available in beige and black color. So available in small, medium, large, X large, and black and beige, and three different lengths. We have also the Ready Wrap Gauntlet, which is available for the wrist area, where you can have it in right and left, beige and black, and small, medium, large, and X large, in order to cover and bandage the wrist area. Also the color code straps. Uh, Also, Ready Wrap, we have from it the lower limb, where we have 5 pieces for the lower limb, from the toes, ankle, cuff, knee, and thigh, for some other lymphedema indications. Uh, I will keep, if you have any question, we can start the question and answers section, part of the webinar, and we can see your questions here. Uh, so I have a question from Meili. What is intermittent compression?
Yeah, okay. The intermittent compression refers to these devices that they have a kind of balloon, or actually like a boot or for an arm, a sleeve containing different chambers with air. So they blow the air in the different chambers, starting from the distal to the proximal part, creating a lymph flow. There are some indications, but as I said before about lymphedema, there's a lot of controversy. I know big clinics, they use it. From my perspective, it's something that, yes, a clinic might use if you prepare the extremity and if you apply other measures too, but I wouldn't recommend that easily for home use unless you have an expert patient and there are specific conditions. You know, if since we're talking about intermittent compression, you can even combine it with a complex too. You can put this inside the extremity and you can put the intermittent compression on top, so you can combine a little bit the results.
But also, I think it's important to open the channels or do the MLD before doing
Yes, that's
the
what I mean.
intermittent compression,
No,
right?
normally you do every preparation in the beginning with manual lymph drainage. So a clinic might use the intermittent compression. For my perspective, then it's a question of time. So how much time I can offer to my patient and what alternatives I can do. But yes, a specialized clinic, if they do the preparation with manual lymph drainage, it's a possibility. It's fine for me. With the home use, it's a question because you need a really expert patient that they know how to prepare themselves and to avoid the complications.
Good. Another question, are these products available in India? Yes, these products are available in India, most of them, and we'll send your request to our colleagues in India. Why the compression of the breast only for a few hours?
Yeah, this is something I experience. You know, breast is a very sensitive, the breast gland, the mammary gland, is a very sensitive structure. You know, we know from experience that some women that had a small accident and a small hematoma on the mammary gland, that developed to cancer after a few months or years. So some material, if you apply compression to the breast, can create really redness and sensitive spots. So I would be very careful on how much do I apply. So you can apply it longer. There's not a rule. This is something I'm sharing from the clinical experience. I would say that you can use it depending on the material. For example, this swell spot is quite soft. This is a soft material. There, you know, even this is also soft, not as soft as this, but still it can be aggressive because, you know, don't think what can be applied in the short term, but because the padding can stay pressing the breast for 3, 4, 5, 6, 7, 10 hours. This can be much. So you have to apply the compression. You have to observe next day. So when I offer to my patients compression inside the bra, I during the decongestive phase. So I can see next day what happens. So yes, during the first phase, might tell them to keep them the 24 hours, because then next day I can see myself, and if there's something I don't like, then I can make a rule and say, okay, you can use it less and less. But never forget that the fluid needs flow. So a bra will always compress somewhere more and somewhere less. So yes, consider the balance between compression and freedom, and there is where the answer will come. So yeah, for this is, I'm sharing a concern I have, that the breast, I don't think it can take the pressure that long. And don't say it's not one day. You can put it 24 hours per day, but you cannot put it 24 hours every day, 7 days a week, 365 days a year. Huh? This is what I'm saying.
We have another question. What is the best way to treat axillary web syndrome?
You know, there's no really explanation why it happens. From my perspective, there's these lymphatic vessels that they become like with a thick lymph inside, and because all this is fibrotic. It sticks somewhere to the thorax, and there are mobilization techniques, special techniques. So sometimes you can find a workshop near your area that they can show techniques. You can mobilize through the thorax, and usually after 1-2 sessions or 3, you can even hear a sound, a click, and then it releases itself and it becomes free. So it's a short treatment, 2 or 3 sessions, and I must be clear that the axillary web syndrome is not always connected to lymphedema. You can have only axillary web syndrome. Sometimes you have it with lymphedema, or with lymphedema you cannot really observe it anymore because it is covered by the lymphedema and you don't really see the problem.
Thank you. We have another question. One patient developed redness after 15 minutes of compression. What would be the cause, and had no cellulitis or redness before compression using 12 chamber compression pump?
Okay,
From Anita.
If you put a compression pump, I think this is the intermittent compression we're talking about.
Yeah.
If you use a device, then you cannot really you can control the pressure, but you cannot feel the pressure. This is the difference between the hands and a device. The device doesn't feel. So sometimes applying this compression might create skin irritation. So, and here we have to differentiate the skin irritation from the infection. So you might not have an infection before, but you might develop an infection after. Why? Maybe you had a small wound, maybe somewhere the extremity was scratched, and maybe from the friction from the device, something went wrong. Or sometimes consider that you can have a bacteria getting in the skin at some point, but because of the system working, then you don't have a reaction, but the bacteria will stay. Then if you create the conditions and a pump and an intermittent compression device, because of the pressure, this pressure might be too much, so it might initiate, it doesn't cause the infection, but it might initiate the infection from a bacteria already in. But I would say this is quite rare. This is just an explanation I can think about. The most possible situation, if you see a redness after the pump, is if you irritate the skin because the compression is too much, the skin is not ready, or other issues like this.
Okay. Will the presentation be available as a recording after? Yes, the recording will be available, and you will be notified with the recording after we finish the webinar. If patient has had an infection during the CDT decongestion phase, when can we continue compression treatment?
So here I will point out one of the 5 measures of CDT, which is the skincare. That's why protecting the skin, cleaning the skin, hydrating the skin, it's really, really critical. It's not therapeutic directly in terms of reducing the volume, but if you don't have the proper skincare, then either you have irritated skin or you have problems of infections. I can say that I never had infections in my life, in my career as a therapist, because I was really very, very careful with my skincare. I always clean, I take care of my patients, I clean their fingers, I hydrate with proper creams. I can even buy them myself and I use them to my patients. But in case that something goes wrong, you don't wash the bandages. I always use double set of bandages, so you can one day you wash and the other day you can use them. You can change them every day. But in case you have an infection, officially you have to stop. You have to start antibiotics. The recommendations from the international guidelines, they talk about penicillin. And then after 2 or 3 days, when the symptoms are reduced, then you continue again. I wouldn't recommend, if you don't have an expert therapist, to apply the treatment with infection. Now, this is the best is if you make a stop, relax the extremity, avoid compression, take antibiotics, and 2 or 3 days later, when the symptoms are reduced, then you can continue.
Okay. Related to the skincare, we have a question. What is the ideal way to take care of the skin?
What is that?
Different. What is the ideal way to take care of the skin? What kind of material we can use? Or
so one thing, I usually use alcohol wipes just to clean it, because if you touch the skin all the time with your hands, I need to clean it very properly. But even if these wipes have alcohol, then they will irritate a little bit. So I prefer cream, hydration cream, but I want the cream to be neutral.
Moisturizer.
No, yeah,
Moisturizer cream, right?
yes, moisturizers. But I need it to be neutral, no perfumes, no special additions, because you never know about the allergies of the patient. A cream might have a special substance that it can be helpful, but if you put it inside the bandages with increased temperature for 24 hours, then it can be dangerous. So just be careful. Use not very special. You can use good quality, but neutral. And sometimes you like them to a little bit more oily, a little bit more thick, not very, very fluid creams. And the best thing you can do before you apply the bandage on top of a cream, you can try it on the skin for 1 day to see if there are reactions. And if there is no reactions, or the most wise option is to use the cream the patient is already using. So you can ask him to bring his own cream from home. This is the best option. Then you can put good hydration. Okay, you don't leave wet the extremity. You put, so you see it absorbs the cream, and then on top of that you can apply every material you like.
We'll take the last two questions. How long should we wait to wear compression garment after applying the cream?
Okay.
I don't think
always,
compression garment is different than bandage here.
yes, I have to differentiate that. So we always we clean and we apply cream before the bandaging, always during the decongestive phase. But if you use a garment, I never apply the cream in the morning before the garment, because then the garment, first of all, it doesn't slide properly. You cannot put it easily. And especially if you think in the hot countries, I'm in the Mediterranean Sea, in South Europe, we have hot summers, or generally even now it's hot. So you will not be able to put on properly the garment if you put the cream before. So what I always recommend to my patients, in the evening, when they take off the garments, having their shower, then you can put the cream, which can stay all night. This is the best strategy you can use.
Yep. Please, I don't know if I'm pronounced it correctly or not. Please, compression for breast edema should be monitored. Does the please is even good for breast edema? I think the compression bra is speaking about the compression bra.
So I don't know if I got
It's
exactly
good
the
for
question, but yes, then you have compression bras. So, they're post-mastectomy bras, and there are some bras that they are more, they're fitting best with compressing the extremities. So they must have wide stripes. They must be wide, they must be covering the whole area. They must have wide bands. And then either you can use only the compression bra, just for a slight compression, or this is something I forgot to mention, but this is also interesting. There is a nice material called TG Vest, which is it's like this tubular, but is very wide, also tubular, and that you can fit your trunk inside with a very slight compression, and you can make your own t-shirt. Clever? It's an expensive material, but relatively cheap if you cut it in pieces of 50 centimeter, like a small t-shirt. So it can cost like 5 to 10 euros per piece, and then you can have easy, flat, and nice compression to your trunk. Your alternative is the bra, and then it's your decision if you want to put any addition inside. So first you can apply compression to the bra, and then you have to decide if you want to apply the uneven padding inside. The uneven paddings, because they are applying, pointy pressure in some spots, then you don't know how they react, so you have to monitor.
good. There is one last question.
One last question then. Okay.
Which I think it's interesting. It was two last questions, but this one is going to be, because people are still sending some questions. Also, there's two. Which one you could choose? Can we understand the planned treatment for the breast cancer patient as a pathway treatment? Can you please share the pathway treatment for breast cancer? I think it is the concept of the CDT, right? There is no specific pathway. There is no or still there is a specific pathway for breast cancer.
Yes, no, I think, there are protocols, there are ways, there are systems, there are sequences of treatments, if we're talking about this, that you can follow, there are rules, but this is now we're talking about the whole training. This is a full course, how
Yes.
you can treat the lymphedema. Yeah. And the other thing is, if we're talking about post-operative treatment, then we're doing only local treatment to help the lymphatic system to grow in the proper direction, also if this is a part of the answer. But as we said, someone has to attend the full course. I think this course takes place in almost every country you can find somewhere, and you can be trained to the lymphedema management.
Yes. Perfect. Then I would like to thank you so much for your time. It was very good presentation and discussion on the compression therapy for post-mastectomy lymphedema. I hope we increase some awareness regarding the breast cancer lymphedema as well during this month. Thank you so much for your time,
Thank you very much,
and
Karam, for the
looking
invitation.
forward to
But
do it again and again and again.
yeah, thanks everybody for the attention. I hope we gave them some insights and options in the lymphedema management. Maybe now you can have new possibilities you can try. And yeah, let's see, maybe in the future we can plan something similar. So nice to have you all
Sure,
with us.
sure. Thank you so much, everyone. Thanks for your time, and see you. Bye.